হ্যালো ভিউয়ার্স, আসসালামু আলাইকুম। ড্রোবাল হেলথ প্রযোজিত আজকে আমাদের একটি বিশেষ শো, বন্ধ্যাত্ব থেকে মাতৃত্বের যাত্রা, নির্দেশনায় ডক্টর গীতা হরিপ্রিয়া। মা ডাকটি শুনতে যতটা না মধুর, তার যাত্রা ততটাই কষ্টকর। প্রতিটি মানুষের জীবনে মা বাবা হতে পারাটা একটি বিশেষ মুহূর্ত। আমরা কখনোই চাইব না বন্ধ্যাত্ব নামক ছোট্ট একটি রোগের সমস্যার কারণে কেউ মা বাবা হতে পারা থেকে বঞ্চিত থাকুক। বাংলাদেশে বন্ধ্যাত্ব এই রোগটি নিয়ে অনেক ভুল ধারণা রয়েছে। আজকে এই বিষয়ে ইন্ডিয়ার বিখ্যাত এবং চেন্নাইয়ের সবথেকে সফলতর ডাক্তার ডক্টর গীতা হরিপ্রিয়া ম্যাডাম আমাদের সঠিক নির্দেশনা প্রদান করবেন। Hello ma'am.
Hi.
Hope you are doing well.
Yeah, very much. And how are you?
Yes, I'm fine too. Ma'am, we are very glad that you are here today. There are several misconceptions in Bangladesh about infertility and infertility treatments. So we're gonna ask you some questions on behalf of the patients who are suffering in infertility. And if you will answer, that will be helpful to our patients. As per the study, there are lots of couples are suffering from infertility. So what is your suggestion to them that our next generation doesn't suffer about that?
Yeah, it's very correct that today the incidence of infertility is very high, and though it's 15% standard worldwide population, still it's 15% of the total population, and the population today is very high. So the number of patients with infertility is very high. Now, if you look at the male and female, initially the female used to be much more than the male, but today male and female infertility are almost equal. Now, the very cause of great concern in female infertility is the fact that the egg numbers are dropping very fast in the female population. It used to drop only about the age of 35, but if you look today, even at 24, 25, 26 years, there is a big drop in the egg numbers, and that causes great concern. Now, why do you think this is there? Because of environmental pollution, because of all the food that we eat, the exposure to pollution, all these things have caused antibodies to develop in the body against the ovary, and therefore the egg numbers have dropped. For the male, it is the same thing. For both the male and female, obesity is a major factor, and eating all the wrong foods, the fast foods, and not eating healthy foods in the form of vegetables, fruits, and all these are very important. And when you don't take all these things, that also contributes to infertility. And it's important to take a little vitamin supplements to actually overcome this problem. And because we know that the number of eggs is low very early, we should do tests for reserve of the ovary, or to see the capacity of the ovary much earlier. Like even at the age of 24, you should start looking for it whether they are married or not married. Because if you find it early, either you can get married fast, or those who are planning a late pregnancy can buck up and then immediately start trying for a pregnancy. Now, regarding the men, with them smoking, alcohol, obesity, and too much of coffee, and stress at work, laptop, sitting in front of the laptop for a very long time, and the systems for a very long time, all these things really help. All these things are really bad, and they cause a lot of infertility. So if you look at all these things and how to prevent it: no smoking, no alcohol, no coffee, and take lots of fruits, lots of vegetables, sleep well, less stress, all these things are important in preventing male infertility.
Thank you, ma'am, for your answer. Lots of female patients are suffering for tube blocks. So don't you think it's a big reason for infertility?
Yeah. It's one of the reasons. I wouldn't say a very big reason. About 35% of patients' infertility is because of the tubal block. Now, when the tube is the meeting place for egg and sperm and the formation of the baby. So if the tube is blocked, then egg and sperm cannot meet. So when the tubal block happens, it can be because of infection, or it can be because the patient has had a sterilization or a procedure to prevent the further babies from being formed. Those who have babies, they try to prevent further pregnancies, and therefore they tie their tubes up. So the two treatments that we have for tubal block